Nobody's giving way at all.
We can speak now to Professor Philip Bainville, Chair of the BMA Council. Philip, good morning.
Morning.
What Marilyn said is, can they just give something? 35% seems excessive. Has that demand actually done more harm than good?
Well, remember, this is not about a pay rise. This is about putting back lost pay in real terms that has gone across the last 10 to 15 years. And, of course, it's exactly the same figure that the MPs have had over that time. So they've had a 35% rise across that time. So it's not an unreasonable ask at all. And the difficulty is, as your patient said, thousands of operations are being cancelled every day because of the understaffing and under-provision in this health service. And junior doctors and senior doctors are leaving the service because they do not feel valued in the way that would keep them in the workplace. And that's the simplicity of the argument. If you don't have doctors, you can't operate.
Well, particularly this week, that's going to be a real challenge. The accusation from the Health Secretary is you've deliberately put patients at greater risk by striking over the Easter holidays. And one day into the strike action, we've got hospitals saying, look, we might have to close parts of our A&E services because we simply don't have the personnel to run them. How much harm are you prepared to inflict to try and get your message heard?
Well, we're trying not to inflict any harm at all. We're trying to get this dispute resolved as quickly and as rapidly as possible. And that's exactly why this week has been chosen, because it was the earliest that we could take further action after talks broke down on the 22nd of March. We are willing to have discussions and negotiations now. It is not us that are putting the preconditions in place. And indeed, I'm sure that your listeners will be interested to know that I have been talking to ACAS about the possibility of breaking down some of the preconditions that have been put on the juniors by this government to try and get this dispute resolved as quickly as possible.
We know that you've done that successfully in the past. Tell us more about the details of that discussion. What might you be breaking down?
Well, I mean, the fundamental issue here is that we have a Secretary of State that doesn't seem to appreciate that pay for junior doctors has gone down in real terms. We've also got a government that says on the one hand that it respects the independent pay review body, but then doesn't honour its recommendation with the other hand. So we do need someone to start brokering realistic talks. The figure of 35% is not at all unreasonable. The question is how we get to it. But we need to be in the room to discuss how to get to it and what it means for different doctors across what kind of different timescale. We find the belligerence of this government astounding. I've been chair of council now for 9 months, and I've only had one meeting with the Secretary of State for Health across that time, and that was very heavily choreographed. I mean, I would expect to be having discussions about the wider NHS so that we can get on with the business of treating patients, because this is something that was present before we went into the pandemic. This, the crisis that's in the NHS at the moment is not about the junior doctors' strike. We need to get them fair pay to get on with the work in hand.
The government have been completely consistent. They say 35% is unreasonable and unaffordable. The Prime Minister's official spokesman said, what we would like is for the BMA to withdraw that starting point from 35% and call off the strike, and then we'll be happy to negotiate. What's unfair about that?
Well, I mean, unfortunately, there's no trust between the junior doctors and government. The last time that the junior doctors were in dispute and they called off their industrial action, they ended up with a contract that was imposed. And, there's a bit of a hangover to that period of time. Similarly, the point at which that contract said that, if circumstances change, we will change the value of the pay rise, this government chose not to go along with the DDRB recommendation, the pay review body recommendation.
Talks, we end up in deadlock, don't we? You won't budge, they won't budge. So what is the solution? Is it going to be more picket lines? Are you going to strike again after this week?
Oh, I don't think it's true that we won't budge. We've come up with lots of suggestions as to how to get into talks, and you will continue to see us applying every effort across today, across the rest of this week, and immediately after any strike actions. We are very keen to get this resolved as quickly as possible.
The government are very keen for you to budge on 35%. It sounds as though there's no wiggle room.
Well, they haven't even discussed with us what pay restoration means. Get into the room and discuss pay restoration. Whether that means 35% or not, let's get into that negotiation. This is not about a number. This is about restoring the value for doctors who are not worth less now than they were in 2008.
Can we look at what happened with the nurses? They were flexible. They started off by saying, look, we want 19%, and that was just something that was, again, deemed unaffordable. They met the government halfway. Could you not do that?
But this is not about pay rises. This is about putting money back. And, there are a number of charts showing the relative reduction in pay across the last 10 years for doctors. So, I can't preempt a negotiation. That's why we have a negotiation. But I think what it's important to realise is that you have to be in the room discussing with no preconditions about whether. So, for example, the junior doctors are trying to have discussions with the government. They all work around the country, and it was an emphatic: you cannot negotiate remotely. All meetings have to be face to face in the Department of Health. Well, ACAS does not insist on that. It's adopted IT very well in its negotiation. So there's one immediate example of how we could make progress.
It just doesn't appear to be a negotiation if you're not prepared to move on it. And look, we've got some quoted in the Times this morning. We've got a hospital leader saying they were more concerned about clinical safety than at any time during the COVID surges, saying if a couple of key posts go sick, we're in trouble. What may happen over the next few days, and of course you want a strike to be disruptive, is that there are deaths because the level of service that was needed in hospitals wasn't there. How much harm are you prepared to inflict to stay firm to your point of 35%?
I think we have to remember that there are hundreds of deaths every week because of the state of the NHS at this point in time in terms of underfunding and shortage of beds. And we've got people choosing not to go into hospitals every day on non-strike days because they don't want to die on a hospital trolley in the middle of a corridor without anyone around them. So you are saying we're not prepared to shift from 35%. It is a misleading assumption that this is a figure that cannot be discussed within a negotiation and how one can get to that figure. So it is not a precondition of talks that we are demanding, or the junior doctors are demanding 35%. What they're saying is the figures show that this is what the value has been lost in our wages across that period of time. If the reality is that 1 in 3 junior doctors now is heading abroad, we've already got 10,000 vacancies for doctors in this country. If we had the appropriate number of doctors compared with Europe, we'd have another 40,000 doctors. So, actually, this is a health service that's in crisis. We are materially trying to sort out this crisis by suggesting that paying someone £19 an hour instead of £14 an hour, I pay people who help me at home more than that, and they don't have £100,000 of debt going into work as they start. And these are young.
Professor Manford, sorry, can I just jump in with a quick factual question? You said that you're now talking to ACAS. I just wonder if you know whether the government likewise is talking to ACAS about this particular dispute, or if you know maybe through ACAS how the government might respond.
No, what I'm doing at the moment is exploring every single option that might be possible, but it is a fallacy that this cannot be afforded. After tax and national insurance, we're talking about £1 billion. That sounds an awful lot of money. That's a quarter of the PPE that went up in smoke because they bought it and it wasn't fit for purpose. It's 1/37th of the money that was wasted on a test and trace system. It is around the same money that this government gave the rail companies to not settle the rail dispute. So it is an absolute fallacy that in a rich country like the UK, it cannot afford to pay its healthcare workers properly.
Professor, thank you very much for your time. Professor Philip Banfield is chair of the BMA Council. We would have loved to be able to put some of those claims directly to the government. No one was available to speak to us today.
18 minutes past 8 now.